Hello, Overcomers, and welcome to this episode of Connect Over Coffee. I'm Runsi, the founder of Overcome, and today we are joined by a great champion of Overcome and a friend, Dr. Judith Smith. So Dr. Smith is professor and director of Women's Health Integrative Medicine Research Program at UT Health, and she's here with us to talk about the critical role and importance of integrative medicine in overcoming ovarian cancer. So join us for the next 45 minutes to an hour as we chat with Dr. Smith about the importance of integrating traditional, conventional medicine with complementary medicines and how it is immensely beneficial to all our overcomers. And if you have any questions as we go along, please type in the comment sections below and we will get it addressed post the discussion. So with that, a huge welcome back to you, Dr. Judith Smith, to this episode of Connect Over Coffee. Always an honor and pleasure to have you with us.
Thank you so much. It's so great to be here with you all today.
Dr. Smith, we have a lot of questions. So, just to start us off with some basics, tell us why healthy eating and mindful living is important, not only at diagnosis, but also during treatment and in remission of ovarian cancer, and what physiological improvements happen when we follow mindful living.
So that is a great question. Lots to unpack there. So first, the reason why we want healthy eating and mindful living as far as decreasing stress levels is all of that mental stress, as well as not eating well, not sleeping well, causes physiological stress. And what physiological stress means is it's in our body, it's creating a pathway we call silent inflammation, and that actually promotes cancer growth. It releases different types of chemicals and signals. I don't want to get too technical on all you need to know is that physiological stress, which is related to mental stress that's caused from lack of sleep, from not eating well, because when our body doesn't have adequate nutrition, we don't function well, we don't think well. All of those things cause that physiological stress. And so that inevitably will cause more cancer to grow, or if you don't have cancer, it could activate that cancer pathway. It also contributes to obesity. So a lot of people who struggle with weight loss, sometimes they're like, I am eating well and I am exercising, but then they're only sleeping, a few hours a night or not enough for their body. And, every person is different. And so that's where we kind of been doing a lot of research to try and define, how can we predict how person A versus person B, how much their sleep requirement is. So a lot of times when I have patients or even friends that are like, I'm struggling with weight loss, one of the first things I ask them is, how much are you sleeping? And oh yeah, well then why don't you try and increase your sleep? And then they can start to see the pounds start to come off, even, assuming they're also exercising regularly. And regularly is defined differently for every person as well. It doesn't necessarily, if you haven't been to a gym or haven't exercised in a very long time, working up to it, small steps, I recognize that it's not easy to get back into that routine, but small steps towards it each week to get back into a regular exercise routine, and then those healthy choices. And those healthy choices also kind of contribute to having our body have good glucose levels, which helps with preventing cancer and obesity. And obesity and cancer kind of go hand in hand. It's one of our number one risk factors for a majority of the solid tumor cancers is obesity. So we want to really always stay on top of that. I kind of always preach, if we could solve the obesity problem here, especially in the United States, we'd probably have the biggest impact on cancer prevention than any of our other interventions. So that's where, and then that psychological stress, and that comes from lack of sleep, from worrying about things that we can't control. It definitely adds to that physiological stress as well. So being able to take a break, recharge our mental batteries is really important. Exercise is a good way to do that. So it's a win-win in that sense. And then getting just a break really can help you handle the information overload that you see during the whole cancer pathway as well. So that kind of just helps everything go better.
Wonderful. Thank you for that summary. So, as you talked about, we understand the importance of good diet in our everyday well-being and everyday lives, right? So, how would you define a good diet, and what are the recommended portions of carbs versus fats, protein, fiber, etc., for our overcomers that are undergoing treatment? And if you could describe the plate for us,
yes,
for an overcomer that's going through treatment or has been diagnosed, that would be wonderful. And the follow up to that question is, as you said, it's unique for every person, right? And so does the recommendation differ now based on the age or the stage of the disease, or is it uniform across the board? If you could shed some light into that.
Now, when it comes to diet, I am a big advocate for consistency. So a lot of the fad diets, and I'm not going to call any one particular diet out, but ones that exclude food groups or focus on loading on one food group is not usually sustainable for a lifetime, so to speak. And I always kind of preach, if you should pick a healthy diet that you would give to your 5-year-old to your 95-year-old and everyone in between, so that it's that is safe for everyone. Mm-hmm. And the plate you're referring to is a great website. It's called myplate.gov. So it's universally available both in the US or around the world. Anyone can pull it up, but it gives you a visualization of the food portions. Right. And I would tell everyone to look at the palm of their hand, and each person's palm of the hand is a little bit different size. So the portion controls should no longer ever be bigger than that palm of your hand. And that's where, especially with small children, I think we always want to load up their plates with all this good, healthy food. A lot, too much of that good, healthy food that's like the size of mom's palm of her hand and not the baby's palm of her hand is too much. So that's why babies and children, much smaller portions. And, it's okay if they say they're full, you really should, okay, that's enough. They tend to do better with grazing and eating 6 small meals a day. Society-wise, we're all used to those 3 big meals a day. And from a health standpoint, it's actually probably better to eat 6 smaller portions throughout the day. Mm-hmm. Or having those healthy snacks and eating smaller portions at meal times, and not those big traditional meals, saving for very special occasions, of course, but in general, it's probably not the best portion control. So myplate.gov, you can see that visualization where fruits and vegetables are going to be your largest portion. They're a great source of minerals and vitamins that our body needs. Protein is important. I emphasize protein during treatment. You do have a higher protein content, but you can use supplements like protein shakes, protein bars that have 20 to 30 grams of protein, because that helps with not a high calorie intake with that protein, but also the protein helps with healing and helping with recovery during treatment. So when patients are on active treatment, their protein requirements are generally in the 100 to 120 grams per day. That is really hard to consume in a diet of protein alone. So that's where I really recommend protein shakes, and reading those labels becomes really important, because you want to look at that protein carb ratio. You do need some carbs in there for the protein absorption so that the protein can work. But you don't want a ton of carbs. And flavor is important for a lot of patients. They don't want something that tastes too yucky or too. A lot of my patients complain some of them are just generally too sweet because they try to overcompensate for the protein flavors. And you can also get protein powders that you can put into fruit smoothies that you can make at home. You don't have to go to some fancy fruit smoothie store. I make them for my kids all the time at home. Just get some berries and throw that protein powder in. They don't know no different. Really important for those people that are starting exercise. Remember, you need that little extra protein for muscle recovery, maybe right before you work out, or definitely right after, to help with muscle recovery. And that will prevent the soreness that we all feel like after we get back into the exercise routine, but that's something good to sustain as you continue to exercise. So, and excluding any one food group is generally not sustainable, and our body needs all those food groups. So even dairy is important, and you'll see dairy is also a very small portion on myplate.gov, so that is not a ton of dairy. For vegetarians, there's a lot of other alternative sources of protein, your beans, and other sources, and using those protein supplements as well. That's really important. And that way you can sustain that definitely throughout treatment, definitely in that recovery, and then using other nutritional supplements, I'm sure we'll get into, that can help with that recovery phase as well.
Wonderful. So talk to us about, because I've read some articles on the role of dairy in ovarian cancer development as well as the progression. So do overcomers who stay on non-dairy products do better in terms of overall health management from your experience? And if they do, then why is that?
Stay on non-dairy products, you said?
Yeah. So basically, I've read a few articles where they say that dairy has a role, may negatively impact the disease progression and development in ovarian cancer. So my question was, do you think that our overcomers who stay on a non-dairy kind of diet do better in terms of their overall health management, or is there any substantiated evidence to that or not?
I don't know if we have enough data to really confidently say that dairy alone is a risk factor, or dairy consumption, because if you think the studies that would need to be done to really verify that are quite large and difficult to prove definitively. I guess it depends again on your portion control of dairy. So like people who consume too much dairy, that's really often high calories. So, like drinking low fat milk or using low fat dairy products is recommended, because it kind of ties more back into that obesity factor. And sometimes if people are consuming too much dairy, are really also putting on too many calories, because figuring out like what your calorie requirements is really good step to your basic health, to find out based on where I'm at today and the weight that I want to be, what are my calorie intake requirements, and then using myplate.gov to get the right proportions of foods on that. The big concern with like taking dairy out of your diet is making sure the bone strength is, you're supplementing your bones with both the vitamin D, the calcium, and minerals that your bones need, because treatment does cause a lot of and bone weakness. And so that would be my word of caution. If you want to limit your dairy intake, that you're compensating for those minerals and vitamins that you need.
And that's a great segue into my next question, which was, there's a lot of recent research on the role of vitamin D in cancer development and progression. So tell us about the importance of vitamin D, and what should our overcomers know and ask about adding this supplement to their overall diet?
So the first step is making sure we check our vitamin D levels. We have done extremely well as a society in wearing sunscreen outside and preventing melanoma and skin cancer. But unfortunately, our major source of vitamin D is actually from getting sun exposure and natural biosynthesis conversion. So, we always run that double-edged sword of like, I don't want to tell people to go out and sunbathe because I don't want them to end up with skin cancer. When you were wearing sunscreen, though, that protects against skin cancer, but it also limits the vitamin D conversion. So, and generally, even for healthy bones, we want the level to be above 30. But when we get for that cancer prevention, there's another step in between, is like immune protection, which is really helpful when you're going through therapy to prevent infections. That we generally want to be in that 40 to 60 range, and then above 60 for cancer prevention. So a lot of our patients, especially in the breast cancer data, we can extrapolate from that, where they've actually shown this a little bit more definitively because it's a larger patient population. where that keeping those vitamin D levels higher can really help with cancer prevention. So to get to those levels, we generally have to use prescription vitamin D, which is a high dose of 50,000. It has special formulation, so it's absorbed better, and it's like once a week. And once we get you to that window, then maintaining it with a regular vitamin D supplement. Doesn't hurt to start trying a lot of the over-the-counter, 2,000, I think is anywhere from 400 up to like 4,000 units vitamin D. The body can utilize well. It's water soluble, so it's not a real big concern. But to get to that corrected level, it's very difficult to do with those low doses. And then we do definitely recommend continuing to monitor your vitamin D level throughout. But it's difficult to get it through diet alone. Yeah. You need the supplements, and a lot of good data for not only bone health, immune support, and then the cancer prevention. So it's definitely checking.
One question on the vitamin D. You said that it is obviously recommended that you check your vitamin D levels before taking supplementation, but at the same time, the 2,000 that you talked about, is that something that, even if I didn't check my vitamin D today, could I just go and get it over the counter and just start taking it safely, or no?
You can take it safely. I'm just saying it might not correct you to the level where you want to be. The reason to check your level is to find out, like, am I close to where you need to be? And maintaining a regular daily supplement will keep me there, or do I need to basically load it up a little bit and get me into that range? Because once you get above and where to that range where you want to be, taking a daily supplement maintains it. Makes sense. You have to get there, and that's the challenge. So sometimes you may be taking 2,000, 4,000 units, but if your level is 16, it's not going to get it up there fast enough. It's just maintaining. It maintains the level you're at, I guess, is the best way of putting it, rather than correcting for a deficit. And the other good thing about vitamin D also, for those patients in early stages where they're recovering from surgery, still, it does really help with recovery from surgery or healing, basically bone fractures. Anyone breaks a bone, extra vitamin D does help with that as well.
Wonderful to know that. Thank you for sharing all that. Supplements in general, right? I mean, it's not just vitamin D, there are many other supplements out in the market. So in terms of your recommendations to our overcomers, in terms of adding these supplements to their overall health management, what would you recommend? Which supplements would you recommend, and which ones would you not, and why?
Okay, so again, another loaded question, but so as far as there are supplements that are safe, it is always important to include your healthcare team in your discussion of what supplements you're taking. But a good nutrition foundation will help, not only for the patients undergoing treatment in recovery, but even for family members to help support themselves as they're supporting the patients. So that includes a multivitamin with iron for the patients, because that hemoglobin, that is really important for maintaining energy levels, can drop down during treatment. So having that multivitamin with iron may help maintain the hemoglobin counts a little bit better and prevent anemia, which means your hemoglobin is low. We also do recommend the calcium supplement from the get-go to help maintain your bone strength. Probiotics is a non-antioxidant way, so it's a safer way to help boost up the immune system, and that works via the gut, which actually controls a lot more of our immune system than we ever realized. So really those probiotics, a lot of people think probiotics and bowel function. That may be an added bonus in my mind. It's more for the immune support is why I want them to be on a probiotic. And then one of my favorite supplements is omega-3s, which are generally from fish oil. Getting the right fish oil product. There's a whole spectrum of them out there. Reading the labels is important. You want that 3-to-2 ratio of the DH and EPA so that you're getting adequate omega-3s. And generally, If you can, take it at least twice a day, even better 3 times a day, but that's really hard to achieve because most people are out and about during the middle of the day. But taking it with food, that helps with immune strength. It helps prevent some of our treatment neuropathy toxicities. It also can help with those hot flashes from the surgical menopause, that even postmenopausal women still kind of have some of those menopause recall when they undergo the hysterectomy as part of their primary treatment. So fish oil also has been shown. We also did a lot of research in my lab here to show the safety of maca root to help with those hot flashes. It is one of the many, there's 17 different phytoestrogens. Some of them do bind to the estrogen receptors. Maca root does not, but it does help. It has clinical data that has shown even non-cancer patients helping control menopausal symptoms. So we use that in combination with the omega-3s and then a fiber supplement as well to help maintain estrogen reabsorption. And we start a lot of our patients in our patient education from the get-go has all of those supplement recommendations to start. Vitamin B6 is another one that patients undergoing active treatment. Vitamin B6 has a dual benefit, preventing neuropathy and also giving you energy. Okay. So when people need that little extra energy, the vitamin B is a safe way of getting that extra energy. Those are all good options. As far as supplements to avoid, that's a much longer list. There are ones like, I think the one I hear patients mention a lot is like milk thistle to help clean their liver or detox their liver. Can cause a lot of unpredictable, what we call eratogenic liver failure. So we try to avoid those. Generally, there's a lot of supplements that may interact with the chemotherapy. So antioxidants is a big no-no. Not only like when you are undergoing treatment, but even after treatment, high doses of antioxidants can actually promote cancer growth in patients who've already had cancer. It's a double-edged sword. It can prevent cancer. There's great data for that, but that's in people who haven't had cancer before and don't have any pre-existing cancer already in their body. So it's important to do screening before starting any antioxidants.
Wonderful. So, and this was very beneficial. I'm pretty sure everyone who's listening to this conversation will take away a lot from your recommended supplements. Just to summarize, I think I heard vitamin D. I heard these are all the safe ones: the calcium, the omega-3, the B6, and always kind of talk to your physician on what is appropriate for you and what dosage, etc., before starting any regimen. But in general, these supplements can be considered safe while you're going through the treatment. So thank you for that. And you mentioned a little bit about sleep as we started the conversation, right? So tell us about the importance of sleep in overcoming ovarian cancer, because we have heard that many of our overcomers complain about sleep disruption due to some treatment side effects, especially when they're on PARP. It's somehow, I don't know how that happens, but it somehow interacts with their sleep patterns and just does not help them sleep well. So share with us a few ways to have that restorative sleep during when they're going through those strong like treatment cycles. What would you recommend?
So your first part of why it's important, use the key word there is restorative, because that sleep is our time when our body does have a time to rebuild and fix itself base up overnight. And so all that stress that we have during the day, a lot of repair happens overnight when we're sleeping. So that's why sleep is so important. It is also important for our mental focus to be able to listen and focus and cope with day. Like we all know when we're overtired, we tend to be a little bit more emotional and can't hear as well, can't focus. But the cell recovery and recovery from treatment is probably what's more important. And a lot of the drug therapies that we have can interrupt with hormone levels that interrupt sleep, or in self may be more of you're getting steroids to help with the nausea, but then inadvertently keeps you awake. Paying attention and asking the pharmacist when you're getting those prescriptions filled, like a lot of our anti-cancer hormones, I generally always tell our patients to take those in the morning if you're going to be on those, because that will keep you awake. And a lot of our patients are on medications to help with hot flash called Effexor, 5-HT3 agents that can help keep, though will not help, but will keep you awake. So again, those are better in the morning than in the evening, so that your levels are dropping down by the time you're trying to go to sleep. The things that can help you sleep better is getting into good sleep habits. And what I mean by sleep habits is trying to make sure your body has all the signals that it's time to sleep. So making sure you're not, falling asleep and taking those cat naps on the couch or in the chair while you're watching TV. Like if you're starting to feel yourself get tired or dozing off, it's a time to turn the TV off and go to your bedroom, and making sure keeping the temperatures a little cooler, at least in the bedrooms, helps you sleep better. Trying to use either those like light out blinds or curtains to kind of keep your room darker. Turning off lights, night lights and things like that will help you sleep a little bit better. Using white noise if you're in an area where you can't really drown out that sound. And then a lot of times people lay down in bed and then they start thinking, mind racing about all the things that happened that day or what they need to do. And what we generally recommend is to get up, write it down, and then go back to bed, because you just kind of have to get it out. So sometimes journaling right before you go to bed might be helpful to decompress for the day, whatever's on your mind. One of the approaches that we have recently learned about to help become more positive is at the end of the day and you'll sleep better, is to think of the 3 good things for that day. 3 things, whatever they may be. My coffee was the right flavor, to I found out, so-and-so's having a baby, whatever. Little things count, big things count. Someone smiled at me today that made me smile. Someone let me into traffic. I know here in Houston, we're like, oh yeah, someone let me in.
That's an important one, by the way.
Huge win sometimes when you're trying to get on, or move over a lane. So like they said, if you spend 10 minutes at the end of the day before you go to bed to write down those 3 positive things, then hopefully that's like mentally clicking that positive energy on in your brain too. Maybe as you fall asleep, you'll continue to think of more good things and maybe fall asleep better. Occasionally though, if it is chemical, like you may need to talk to your physician about helping, something even as simple as over-the-counter diphenhydramine, which is Benadryl, to help just help you get to sleep. Or some patients do need to temporarily take sleep medications to help you sleep because of the other medications we're giving. You kind of have to counteract chemicals with chemicals. And those are usually a short-term plan, not a long-term plan. But that sometime is okay to ask for help if you're really truly not sleeping, because the sleep deprivation is more harm than good. And then the last thing that I would say that keeps people awake is pain. So if your pain is not under control, it can disrupt your sleep. It actually can prevent healing. So there's no awards for tolerating the pain. You don't need to be a warrior and just say, I can take this, I can handle it, I'm strong enough. We all know you're strong enough. The journey that these patients go through is admirable, but being in pain is something we can control really well, and we have lots of ways of controlling it. Mm-hmm. And it's a temporary plan. We can always get you off the medications when the source of pain is resolved. But if it gets to the point where it's also interrupting your sleep, and sometimes you don't even realize it's interrupting your sleep, right? And then, if your pain is not under control, you probably are not sleeping as soundly. You go to sleep, but your body's not truly at rest. And so then you're not having that healing power that you need. So I highly encourage patients to be willing to accept and talk about their pain and get the help that they need for pain control, and assure them it's a temporary plan and we always can stop the pain medications. I think we've emphasized with the opioid crisis too much in society, so people are afraid to take pain medications now. But it's really in the cancer arena, it's more harmful than helpful to stay in pain.
And like you said, if you are under the care of a provider and healthcare team, then it is, if they're recommending, it should be safe to do so. So it's important that you stay connected with your physician and your healthcare team and ask the right questions. And like you said, there is no glory in pain. So, and just manage it better so that you can have an enhanced life, quality of life, and better sleep as well. So thank you for that, Dr. Smith. I was just curious that there are some overcomers who come with a, previous additional chronic condition, right? That could be like heart ailments, it could be like hypertension, it could be diabetes, it could be any immune compromised situation, right? And then they get diagnosed, thyroid problems, whatever that may be. And then they get diagnosed with ovarian cancer. So in those situations, what extra layers of mindful living guidance would you give to our overcomers who are living with that additional chronic condition? Is that any different? Is the guidance different, or is it generally the same?
Mindfulness wise, it's just also communicating and making sure we bring your primary, whoever is managing those conditions, into the discussion, making sure we don't ignore or stop taking our blood pressure medication, stop taking thyroid medications, because all of that extra stress on your body, not controlling those factors, will make the cancer treatment more difficult. So there's a lot of medications we won't give if your blood pressure is too high. Right. And a lot of like our new immunotherapy, which has become a great source of treatment, if our thyroid function gets disruptive, it could definitely cause more problems. GI function, also like ulcers and things like that, we need to keep under control. So I think it's really important to continue, like, to not give up and like, oh, it doesn't matter, I have cancer, because it does matter. Everything fits together in a puzzle, and we need to take care of all parts of our body, and let the oncology team work with your primary team to keep everything, getting you back on that road to healthy and wellness.
Exactly. And then moving on to the role of exercise in overcoming ovarian cancer. So could you kindly break down the different kinds of exercises for us that our overcomers can safely do? And what are your recommendations for, especially for ovarian cancer patients, when it comes to the best forms of exercise for them?
So yeah, exercise is important to help counteract all that fatigue that we talked about, a lot of the medications cause, and the mental stress causes and everything. So it is important, and gauging where you should be on the exercise depends on what you were doing before you were diagnosed. So that's where I said, working yourself up to a higher exercise level, if that wasn't something that was part of your routine before, doesn't mean we can't start exercising, but we're not going to run marathons, and we need to kind of work up to that. So we do want cardio as part of it. That's a good way to build up your heart strength and your overall muscle strength. And it's easy to start to incorporate. So that's where, walking and gauging your walk, how far you're walking based on where you start, and starting and building up each week. In small increments, definitely be helpful. Low impact swimming is a really good way to get build up muscle strength. The only window of time where that's not really recommended is like that immediate post-op period, making sure you've got clearance from the physician that you have clearance to start exercising again. The pool is a great place because of the low impact, and there's some great water aerobics. Even just old-fashioned, freestyle. My daughter's a big swimmer. Don't try a butterfly right off the bat, but if your freestyle backstroke, those seem like the less impactful ones. But definitely that has a win-win from head to toe. Walking is something easy to incorporate, and as you go on, maybe you'll start doing a slow jog walk. Stretching yoga is really good for both mind and physical. And I think, I wouldn't necessarily immediately go to the hot yoga, because that can, especially when on treatment, that really the dehydration level, the risk is higher. But regular yoga is really good for you to stretch and keep your muscles limber. I do think it's really important to do something because more you sit around and rest, which I know a lot of your family members are like, oh, you should rest, you're on treatment and all that. It actually can make you more tired. So, and then if you're tired and napping during the day, then it's like a vicious cycle. Then you can't sleep at night when you're supposed to be sleeping. So because you've rested too much during the day, but you're still tired. So it's kind of a horrible cycle that we get into. So even, we talk to patients, they can walk up and down their stairs or maybe down the block and back, especially if it's something they haven't routinely been doing. And then each time just try to go a little bit more than you did the day before. And then rewards, I think, are important as you meet little goals for yourself. We all like a prize and something to work towards. And whether it's, binge watching your favorite show after you've done so much, or reading a book, or, working towards some special time with someone, or going to do something, especially like that walking, like, hey, I want to go visit so-and-so. I need to be able to walk to be able to do that. So making goals, definitely, and rewarding small milestones. And then I just really think it's important not to get too ambitious too fast, but be realistic, and every little bit helps. I think I commented when we were at the Ovarcoming, like I do little things like trying not to park the closest spot to the store, try to park, maybe you don't want to, I always park in the last spot, but maybe halfway, not the closest spot, but a few stops down. So you're walking just a little bit more to the store. I know a lot of people have gotten, used to trying to get closest to the door, but it's little things like that, or taking the stairs instead of the elevator. Little things like that can help incorporate exercise into your day.
Yeah, I'll tell you that, I used to do that thing where circle around the parking lot until I find the closest spot, right? But I have changed too. I'm like, no, it doesn't matter where I park. It's actually good if I take those additional steps into the store and back. So yeah, we all do that, just kind of like autopilot, trying to find the closest spot to the store. So tell us, lots of research, as you said, lots of research and new things on the horizon for when it comes to integrative medicine and ovarian cancer. What are some of the new things or new research that's ongoing that may have a very, tangible impact in the next few years, you think?
So there, for cancer prevention, there are a lot of things. I know our group has a big publication coming out this week on HPV, which is not related to ovarian cancer, but a lot of other cancers.
Of course. Yes.
But the nutritional supplement that we've been researching actually started with our oncology research. It's called AHCC. It can help boost immune system, modulate the immune system during treatment, help you tolerate treatment better. We have shown a lot of synergy with agents that we use in ovarian cancer, like Doxil and paclitaxel. Our lab has shown a lot of synergy with that. So that's something that, after talking with your oncology team, something that we often incorporate here on our clinical practice to help facilitate and during treatment. And there's a lot of literature and a broad spectrum of solid tumors showing the benefits of adding that nutritional supplement. I think as we continue down the integrative medicine approach, it's going to be things that we know how much immunotherapy plays.
Right.
And cancer is things that can help modulate and boost those immune therapies. So things that we, like the omega-3s and probiotics, are an area where we're going to focus on and showing the benefits on tolerating treatment and responding to treatment. I think is continued. And I think the bigger role for supplements is going to be in cancer prevention and getting healthy, reducing that obesity factor. Supplements have shown a lot of benefit in helping patients shed the pounds. And as I said earlier, I think that's going to have our biggest impact on cancer prevention and prevention of recurrence too. I think a lot of our cancer patients that may be carrying a little extra weight when they're diagnosed, not necessarily want to focus super on that as losing all of that weight during treatment, but definitely as you come out on the other side and that recovery, starting to be a little bit more conscious about, what if one of your best approaches, especially in ovarian cancer, preventing recurrence, is to maybe think about getting back to that healthy weight. business, and working with people to help you get there.
So I have a curious question for you. If you had to design a day of an overcomer for in mindful living, how would you design the day for her?
So my ideal world, you won't wake up to an alarm clock, but you'll wake up on your own. And when you wake up, start your day with all the supplements like your probiotic and your calcium, and take those on an empty stomach. Maybe do a light walk, brisk walk, or if you're a treadmill person, whatever the case may be, outside, inside, get a little exercise in, and then have a nice, well-balanced breakfast, some protein, a little bit of carbs, so some juice, fruit. Definitely fruit is a good way to start your day. Protein shakes, whatever you want to eat with your fruit. And then, definitely engaging with whether it's work or family or whatever during the day, eating regularly throughout the day, maybe a small mid-morning snack, mid-afternoon snack, dinner. And then like that time after dinner to bed to try to not really eat, because it's better for our GI system to not snack after dinner. So maybe even a short family walk after dinner, way to wrap up the day, or bike ride, depending on where people are at, or swim if you have access to a pool. And then, some reading or, short TV time, decompress for the day, try to turn those electronics off within an hour of bedtime to help decompress our brain. Like I like doing those 3 positive things. I think it really does help mentally get you in the right mindset for bed.
Right.
And then having a going to bed when you're not exhausted, but you're ready to sleep, and getting that, generally I recommend, that 6 to 8 hours of sleep. Some people need a little bit more depending on where your body is at. But generally smaller children definitely need more. But getting everyone to bed on a timely fashion and consistently. That would be my ideal day.
That's wonderful. And one of the things I would add to this is I have started this practice on my own is, the first hour after I wake up, I don't touch my phone. So it was hard for the first couple of days. And now it's like, that's what I do. I don't even get to my emails, no, nothing. I am just phone free for the 1 hour after I wake up. I'm just focused on the day, on my children, on my, the family, other things that I want to do. But I'll get to the phone, the emails, the text messages, all of those after the first hour of my waking up. So I feel very cleansed, I think that has helped a lot. So it is also like the mind-body connection. I feel that's so important that we always underestimate, I think, not just in cancer, but just in daily living. But we should continually underscore the importance between the mind-body balance. It's really incredible.
Absolutely, that's great advice. I definitely will do the same. I definitely try to turn that off on the weekends too, because it's hard, like not checking email on weekends and all that. It's really important if you are working to kind of try to make sure you set boundaries.
I will check, but it's just the first hour of the day. I feel like I don't want to be inundated with all those text messages and the phone calls and the emails that I can get to after 8 o'clock. You know what I mean? So that I feel that has changed a lot of things for me. And that is something I want to hold on to for, going forward. So, so Dr. Smith, currently, what percentage of hospitals or care programs implement these kinds of integrative medicine, just off the top of your head, because my question is for those overcomers that are being treated in hospitals with no programs like this in place, right? Like the smaller community hospitals, et cetera. What advice would you give to them to seek out integrative medicine programs outside of their immediate care team?
Yeah, I think that they do tend to be a little bit more common in larger academic centers, and I can't say every academic program, but it does seem like it's the resources are there. And we are more than happy to work with oncology teams in the community. So, just reaching out to whatever program might be closest to you and saying like, hey, can I get some guidance? Most of us have resources that are online so that you can pull those using foundations like Overcome to help get that information, and just making sure you're communicating with your healthcare team where the information came from. There is a lot of good academic research, like Memorial Sloan Kettering has a great website, and the Anderson has a great website that patients can readily review and download that information and bring it to their healthcare team.
Absolutely.
And definitely incorporate. And then there's some great books out there too. I just, always, recommend, run it by somebody before you start reading, because there is misinformation out there. My take home is like, it's not one or the other. The integrative is the key word in the process, is that really nutritional supplements and herbal approaches are not going to cure cancer on their own. And our traditional approaches, Western medicine is what we often call it, our chemo, our immunotherapy may not necessarily do the best for the patient on its own either. And integrating the two together, the patient can have that balance of wellness and cure for their cancer.
That's wonderful. Thank you. So from your research, you've done a lot of work on this, but in general, from your experience, do you think we could prolong remission by mindful living? What is your opinion on that?
I think the mindful living, gets back to where we started with decreasing that physiological stress, and that's definitely help with cancer prevention, because you're decreasing those all those stress signals that activate cancer pathways. So and your mindful living and wellness is going to decrease obesity. So those are all the things that you have control over in taking care of your mental health, taking care of your physical health, as what losing those extra pounds, or just eating healthier and well-balanced diets, getting enough sleep. Those are the things that are going to decrease all the risk factors that could decrease your immune function, which is also key in cancer prevention, is having a strong immune system. So those are all things we want to do.
Such simple steps, though. Just sleep better, eat better, exercise, right? I mean, it sounds very simple, but they are so basic and yet so profound and powerful in, not only cancer prevention, but also for the cancer, for longer remission when the patients go into remission. So important for us to focus on that.
I think women in general, and I don't mean to down any men out there, but I think women tend to forget to take care of themselves.
Yes.
We're inherently or naturally caretakers for everyone else around us, whether it's our children, our family, our friends, whoever else may be, and taking care of them. And we just have to remember, we don't take care of ourselves first, we're not going to be here to take care of everyone else. So the biggest gift you can give your family, your friends, your children is taking good care of yourself first. So
that's a wonderful message. Thank you, Dr. Smith. So I've asked you a whole spectrum of questions. Is there anything that I have missed that you would like to add to the conversation?
No, I think my only other message would be that every question is a good question, and make sure you really ask your physicians and your healthcare team the why. Why am I doing this, and how does this work? Because it's really important to have a good understanding, and then good communication both ways, letting them know what's going on in your world so that they can help address. Sometimes you don't realize side effects you may be having. Symptoms you may be having are actually side effects of things that we can control and manage.
That makes sense. Yes. So thank you, Dr. Smith. It's a great conversation as always with you. In closing, what message of overcoming would you give to our audience that are listening today?
You can do it, and we're all in this together. I think, it takes a team. And all of us are here for you to overcome. And we have much admiration on the healthcare side of how amazing the Overcome Warriors are.
Thank you so much, Dr. Smith. This was a fascinating conversation. Each time I sit down with you, I learn a whole lot more. So we will definitely get you back as you continue your great work and research in this space, because as our overcomers, like you said, they undergo this, very strong treatment, clinically. It's very important to focus on the mind, body, and, wellness as well. So as new things come along, we'll invite you back to learn more about how we can integrate integrate the traditional with this supplementary treatment so that we can have better outcomes for all our patients. So overcomers, hope this was beneficial for you. I know that I learned a lot from Dr. Smith today, and hope you did as well. And as I always say, please share this great information far and wide with anyone who may benefit by sharing this video globally with anyone who may benefit from this information, all these great insights that Dr. Smith shared with us. And we will be back with the next episode of Connect Over Coffee very soon. I'm your host, Runsi Sen, and I'll be back. And until then, you keep overcoming, because together we can overcome. Thank you and bye.